It's a great story. So, Deidre, we were talking a little before. We have very similar families, right? I mean, ish, right?
Kind of.
So, kind of. I mean, but we're both, but hey, Deidre, I mean, you can share your good news.
So I have a 20-year-old, a 2-year-old, and one on the way.
See, that's exciting. That's exciting. And the best part,
I can go in labor right now, so.
I'll try to keep this easy. I mean, I'm not, do we have an OB? Just in case. So, you know, 2 daughters and a son. Let me tell you, just give you a little advice. Not that you need it, but just a little advice. In a couple years, take your kids to Disney World, the younger.
Oh, we're annual pass holders already. I got you.
Okay, I'm just saying, you know, and just make sure you leave a few months beforehand before you go, and then you'll not want to go for a little while.
Yeah, we actually just did it last weekend. I'm good for the next few months.
There you go. See, annual pass holders, that's pretty big.
Yes.
Favorite park?
Animal Kingdom.
And that's mine too, and it was my first time going there on Tuesday.
And Disney World's better than Disneyland, just so you know.
I'm sure it really is. I'm sure it is. I'll give you the couple pieces. I know it is. I'm sure it is. I mean, obviously, John told me that Walt Disney learned from all of his mistakes at Disneyland, and then he corrected them all at Disney World. And I'm sure there's accuracy to that. The thing I love about Disney World is that the line queues are like their own experience. And at Disneyland, it really is, right? They have all sorts of things. And at Disneyland, the line queues are just boring. You're just waiting in line.
That's actually true.
Yeah, no, it's very true. And I don't know if you've heard Jim Gaffigan talk about Disney World, but if you haven't, you should. It's pretty good. It's pretty good. Look, you'll have to look that one up. Well, I really enjoyed your video. So first of all, you know, we appreciate you doing that. And I noticed in the video, you guys mentioned that this was your 3rd EMR that you have tried out and selected. Tell us a little bit about some of the problems and issues that you faced with your first 2 that led you to change.
So the first EMR was not customizable. It was very difficult. So when you're dealing with psychiatrists and therapy, and then you have the back end, none of it was really, it didn't go well together. So the fact that the first EMR wasn't customizable made it very difficult for the providers when it came to seeing patients and documentation. So we left that EMR, and then we decided to do an in-house EMR, one that was not web-based, and that was the biggest mistake that we made. That one was very difficult as well. They promised us customizable forms, and that did not happen. Our providers were not able to actually do work if sometimes they would do it at home or take a day off and be able to do it, but they had to come to the office to do it versus a web-based performance program. So it was very difficult, and it crashed a lot. So there were days we came in and we didn't know if we had an EMR or if we had to go on paper. And so it was challenging, because at that point we decided why did we even do EMR when we can just go back to the old days and use paper?
And have all those charts. Everyone remembers those days.
We had those.
There you go. So tell us, when you were choosing an EHR, what was important to you? What considerations did you make in order to help your practice and help the growth that you needed to have?
Well, first of all, for the providers, if anybody in here is in psychiatry, you know that it's a very grueling process with the amount of patients they see a day, but just not even with the amount of patients they see, but the different disease states that they see. Some of these patients can be anywhere from simple ADHD to high rate of acuity of schizophrenia. So it's very challenging for our providers. It's actually very draining. So one of the things was we needed ease of access for our providers when it came to documentation. That was one of the things that we wanted to look at. The customizable forms. Some of our psychiatrists work different than others. The other thing too is we are Medicaid, Medicare facility, so some of the what the requirements are compared to commercial plans are different. So we needed our forms to match what our insurance agents wanted from us to be able to pass audits. So one of the biggest things we really needed was a system that would allow us to build a platform that was beneficial for us. And with AdvancedMD, that's what we were able to do.
And so how did you discover that through the sales process, that you felt like it would meet your needs?
So it was interesting. We were at our wits' end with the second EMR that we had. Very frustrated. We were in a contract, didn't know what to do. I think I prayed a lot. And one of your sales rep, Amy, she was just very, her follow-up was amazing. And she just, I was pregnant at the time, I remember I was extremely stressful. she just happened to reach out, and it was like a prayer. And at that time, we thought we weren't ready, but we were ready. We knew we were ready. And so I have to say it was a mutual decision that you guys reached out to us at the right time, and we were ready for the process. The great thing that I appreciate about AdvancedMD was you guys really worked to help us get out of the systems that we were in prior. You made it, they weren't pushy, but also helped us to see that, you know what, we can help you from where you're currently at and get you where you need to be. And getting out of the contract was hard, but AdvancedMD helped us to be able to afford getting out of our contract into a new contract with you guys.
That's awesome. Amy Thompson, I imagine.
Yes.
Yeah, she's great. So your video mentioned that you have collection rates now in the high 90s, which is awesome.
95.8.
95.8, that's great. Do you know what growth that represents, or what it was historically before you moved over?
Absolutely. So prior to that, we were in the 80s. It was very tough. Just like the gentleman before said, when you're in the medical field, you don't know what your daily amounts are going to come in, the way the insurances pay. One of the things is we had a billing company prior. We brought our billing in-house with the last two systems, and we've grown. With AdvancedMD, our best is at 95.8. We've seen it. This is our best year of 2019. The revenues have grown. We love the bill out process. We're able to catch mistakes ahead of the game. I mean, something as simple as a zip code's kicked back. Like it knows it doesn't match that address. So we're able to prevent all of the denials. My billing team now has gone from working in office to working at home. I have 4 specialists. They're able to work together and collaborate. So I can tell you that from where we were before to where we are now, the revenue has increased tremendously. I would say about 18% of what we've seen of an increase over time.
That's amazing. That really is. You know, and you mentioned so now you have some at home, you've been able to home shore some of your billers. I was just wondering, you can let me know. I've always wanted to work from home, so at some point.
It's too late.
At some point you can let me know. So it's good. I mean, it's great to be able to offer people flexibility.
Absolutely.
That helps meet their life needs.
Absolutely, and it also helps too because they're able to focus more on the billing aspect side of it, so they're not have so many interruptions. And with that being said, they're really able to fight for the money. And any other system that we had before, they weren't able to work from home. So this is the first time that we actually were able to offer at home. We actually had an employee that moved to North Carolina from Florida, and we were able to keep her on board to work with our billing services. So it works great for our company, and she's an amazing asset for us.
That's awesome. And she probably had to give up her annual pass to Disney World. Or maybe she just commutes. I mean, North Carolina's not that far, right? Short flight?
Yeah, and they don't, you're right.
Short flight.
I think that's a good assessment.
So being in mental health, talk about how your software and specifically your EHR needs are unique with both physician and therapists and the patient, and how AdvancedMD helps accommodate for those.
So obviously the notes are different from a psychiatry level to a therapy level. One of the biggest things is, again, the customizable forms, but they're also integrated. So when a therapist wants to have questions on maybe a diagnosis that the doctor made or wants to see what was discussed, it's easy access. They have access to that. So for the therapy and the doctor side, even our treatment teams, they're able to go in and see the documentation, see what the patient's experiencing, and discuss it. So definitely from both spectrums, they're able to integrate. So it helps a lot. As far as the patient, I can say that what we love, before we didn't have the availability, well, with the psychiatric note, I don't know if you know, it's a little bit more confidential. So you don't just print out the note and give it to the patient, because they might have discussed something with the doctor, the therapist, that you don't want to share. So we love the summary of notes that we're able to give to the providers or to the patients outside of our practice. So altogether, it's been a very, very good reward for both our physicians and our therapists to integrate, as far as the training as well. And then it's also been helpful for our patients because we're able to offer them more. Before, we weren't even able to print a list of their appointments or even the patient portal. We didn't even have access to that through our past EMRs. It wasn't that customizable. So for us, it's been a very good bridge with the gap between the providers and the patients and then our therapists.
Awesome. Well, anything parting thoughts you want to share with the group?
I have to say, at the end of the day, our providers are scared to make a change.
Sure.
Change is very difficult, especially for doctors. We know how doctors work. So they can have a good day, they can have a bad day. But I can tell you the first thing and foremost for our practice when we were trying to keep providers to stay on board was They needed to come in and know that when they sat down, they were going to get the list of their patients and their day was going to start off right when it comes to EMR, meaning no crashes, nothing failing, having access to patients' notes. So this has been, I have to say, an amazing, amazing change for us. We see anywhere from 200 to 250 patients a day across the spectrum. So for us, you know, it needs to go, it needs to flow. So I can say that this has been almost 2 years since we've had this system. When I actually got the system, I was scared because I was pregnant and I was going on maternity leave. So I was thinking, how is this going to flow? And my team did amazing. We're always learning every day. I have to say that the staff that we always speak to have been great. Our sales team has been great. But I really love is that you guys are always evolving and things are coming up new. So when we got to meet with your media team, we learned of so many new things that were coming up. We were like, what? That's happening? Are you kidding me? We didn't know that was going on. So it's really allowed us to see that not only are we changing and looking for what's best, but you guys are too, to help us to build a better practice.
That's right. I mean, it's all about trying to be more.
Exactly,
right?
exactly.
So first of all, Deidre, we are so grateful that you came today. Let's give it up for Deidre, CEO, wife, mother of 3, soon to be, and an annual pass holder. Thank you so much.